With us now is Dr. Andrew. How are you today?
Hi, Donna. I'm doing great. How are you?
Good. We've gotten a chance to get to know each other and kind of like share some laughs over the phone the last couple of months or whatever. And Absolutely. It's so nice to finally be here with you. We're going to be talking about three main things. We're going to be talking about sleep apnea, as I hide. We're going to be talking about dental implants for elderly and Invisalign.
Yep, correct.
But first of all, I want to know, what made you become a dentist?
Sure. So I always knew that I wanted to get into the medical field. Dentistry is great because it's a combination of art and science. And just to break it down on a real small scale, we pretty much either improve people's smiles and confidence or take people out of pain. And I think both of those, have great immediate and long-term results. So I love every aspect of it.
Okay, so you weren't from like a long line of dentists where they said, Andrew, you have to do this.
Yeah, my father was.
Okay.
He passed away recently. But yeah, actually it wasn't like that. And I kind of wanted to do it.
You chose it for yourself.
Yep.
Oh, that's nice.
Yep, thanks.
So you grew up the son of a dentist.
Yep.
Okay, but you chose it for yourself.
Correct.
That's
yep.
awesome.
Yeah,
a lot
you.
of times, especially in families where it is like a family tradition, a lot of times people are like, well, you're going to grow up and you're going to do this. You're going to take over the family business. You're going to do this or that. But it's nice that you chose it for yourself.
Yeah.
So you went to Rutgers, you went to NYU.
Yep.
Right?
Yep.
When you finally got like the ding, you're a dentist, right?
Yep.
How did you celebrate? What was that moment like for you?
So my family and I, we went to a really nice steakhouse in the city. I love steak. So we had Kobe beef.
Nice.
There's only very few places in the nation that have true Kobe beef. Really expensive, but really good. Totally worth it. Would love to do it again at some point. Just hit the ground running right away. Most people, when they graduate, they wait till about end of August of that year. We graduate end of May to get their license. I called the state of New Jersey and told them I want to work starting yesterday. So
right.
so I started working end of June.
Wonderful,
yeah.
Wonderful. So I was making like a kind of a funny face about the sleep apnea. One of the things I told you is that I snore. So much so, and I live alone, so I didn't even know I snore, but my kids, if I'd go on vacation with them or whatever, they're like, oh, Mom. I'm like, really? And I told you, like, maybe once in a while I'd have a glass of wine and it would be worse. Like, my friends would be like, well, you could stay over, but like, and I'm like, but what? So everyone knew but me. Everyone knew but me. So you said now that as a dentist, you're able to sometimes help people with sleep apnea.
Yep.
What's going on with sleep apnea? Why is it so prevalent? Or is it just that people know that they have it now?
So about 30 million Americans have some form of obstructive sleep apnea, but only about 20% of people that have it are actually treated.
Okay.
So the good thing is the ADA told us, because who else is looking at the airway? Who else is literally looking down your throat, in your mouth, other than us, right?
Right, it's a little punching bag in the back, the little UV. Was it a
Yep. We're taking a look at the plumbing, seeing if there's any clogging in the plumbing, right?
Okay.
So we screen first and foremost, and there's different signs to be on the lookout for. So if we have a large tongue that's seating all the way back in the throat, that's a telltale sign. If we have constricted jaws, narrow jaws, things like that, there's no room for the tongue for breathing. If we see signs of mouth breathing, signs of periodontal disease, grinding and clenching in a certain manner that looks like, we need to open up the airway. All these things are telltale signs that maybe we do need to get sleep testing.
What about people that complain of jaw pain? Like in like this type of thing, almost like a TMJ pain? Can that also be related to sleep apnea? It
can absolutely be related. Reason for that is the brain doesn't care about the jaw joint, your teeth. It cares about oxygen first and foremost. You can only live a handful of minutes without oxygen. So if you're not breathing or if you're choking, what the brain can do is take your jaw and grind downward and forwards to open up the airway. In doing so, your jaw would be a little sore, but you're breathing. So it's a catch-22.
So it's like at all costs, they're going to try to, your body's going to try to
breathe and survive. Yeah, it's survival. Yeah.
I had no idea, but you told me I stopped breathing 49 times an hour.
Yeah.
49 times an hour.
At least 10 seconds a time. Yeah.
I used to blame my bad memory on the fact that I had fallen during COVID and thought I had like a concussion still going on or whatever. Injury, but it could be because I have sleep apnea and cannot breathe.
Yeah, probably brain fog. And it's something that we can easily help treat. Yeah. And, you know, it's good to know, especially because then, you know, there's different treatment modalities, you know, one of them being oral appliance that we offer for patients.
So what is it? You have like little models here of that?
Absolutely.
Okay, so what do you have going on here?
So very simply, these are what's called mandibular advancement devices. And what that means is we take that lower jaw that can move and keep it from going back and collapsing.
Okay.
The tongue is connected to the lower jaw. So if we can keep it slightly open and slightly downwards, then we can actually keep that tongue from going back and choking us and, you know, getting in the way of the airway. There's different models of it. For example, this one's called a dorsal, just like how it sounds. It literally looks like a couple of dorsal fins. I like this
or like a vampire.
You can look at it like that too. You can look at it like that
so it's a dorsal fin. Okay, okay.
Yep. I like this one for people that grind and clench. Reason for that, it allows a little bit of lateral movement to the jaw so you're not so fixated. But sometimes in certain cases, we do want to go fixated on both sides. So this is an example of a nylon appliance that is fixated on both sides. It still gives some of that freedom of the jaw joint, so it's not as constricting, but it's a little stronger to keep that, you know, airway, you know, downwards.
And you just pop it in at night.
Yep.
Okay, just like a retainer for somebody that wore braces.
Like 2 retainers basically that connect. Yep.
Got it. Now, speaking of braces, you also have Invisalign. You're good at Invisalign.
Yep. We do a lot of Invisalign.
Okay, so tell us about that. Tell us about Invisalign,
absolutely.
Which kind of works in a very similar way, right? It's just you pop it in, and but it's moving your teeth.
Yeah, so it's invisible braces. So about 70 to 97% of people have some type of bite issues. Bite issues over time can lead to, well, first of all, it's hard to clean around teeth that are crowded, things like that, misaligned. So it'll be better for the gums, less prone to cavities, less prone to teeth breaking, so less fillings, crowns, you know, implants, things like that down the road, just by putting the teeth in the proper position. So here I do Invisalign. What that is we basically take these invisible clear aligners, put them on the teeth. We wear them 22 hours a day. Once we're all said and done, teeth are nice and straight. We have, you know, more expansion, so better airway, you know, more room for the tongue, better position of the teeth, less likely to break teeth, easier to clean the teeth, less likely to get cavities, things like that.
Interesting. I'm wondering why they don't use Invisalign for people that have sleep apnea, because then you could have 2 things at once.
So we actually do in some cases, you know, that are, you know, either approaching the mild threshold or very mild, that mild expansion of the jaws can help open up the tongue.
As I'm laughing because my situation is not mild.
You're a little bit above that. Yeah.
Above
We're a little beyond that. But,
okay,
you know,
scary.
We'll still, you know, we'll try oral appliance and see, you know, how that fares in terms of helping you with the symptoms and whatnot.
One of the other things we were talking about was gum health, right?
Yep.
Periodontal gum disease, right? Is when your gum starts moving away from your teeth, which makes you have teeth loss, which makes you need implants. Okay. At what age do people start needing that? Could it be young or?
Could be young, could be older. So about 47% of the population, adult population, has some form of periodontitis, which is, you know, gum and bone loss. And this is across all nations. It's just, you know, mostly genetics. But poor oral hygiene, smoking, uncontrolled diabetes, all these things can also factor into that as well. These are things we can control as opposed to the genetic aspect.
Okay.
So with that being said, about 10% of adults over 18 in the nation have no teeth. And
Wait, can you say that again, Doctor?
Yeah,
I'm sorry.
absolutely.
That was shocking to me.
Yeah.
What was that? About how many?
Of adults over 18,
right?
About 10% of people have no teeth.
They lost their teeth.
Yep.
My goodness. Okay.
And about 25% of people in the age range of 65 to 74 also have no teeth. So that's a lot. You know, 1 out of 4 in that age range.
Goodness. Okay.
So with that, you know, I do recommend doing implants. You know, they're the closest thing to natural teeth. I wouldn't wish a denture on my worst enemy. You know, something that pops in and out. Basically, an acrylic plate that seats is never going to be as comfortable or as functioning as natural teeth. Yeah.
Now, sometimes though, with gum disease also comes like a little bit of bone loss. I've heard, I've researched.
Yep.
Are you able to like figure out if they're a good candidate for an implant?
Yeah, absolutely.
Or if you have to like do a calcium replacement or like?
So assuming, you know, the teeth are gone or the teeth are, you know, at the point where they're so mobile that they need to be taken out, we do a CBCT scan. So it's a 3-dimensional bone scan to see exact volumes of bone. And there's different methods that we can do if, let's say, you are lacking in bone, whether it's bone grafting, doing a sinus lift, expanding the bone, densifying the bone. There's a bunch of techniques that we have.
But you can get help.
Yes, absolutely.
Okay.
Yep. And in terms of keeping the teeth, which is, you know, our goal is to always try to keep our natural teeth. You know, we're very good at, you know, seeing early signs of these these chronic conditions such as periodontitis, you know, teaching you how to properly take care of it at home, and also, you know, doing non-surgical and surgical therapy potentially in the office as well.
Now, growing up, they always said that we should brush our teeth 3 times a day. People, I don't believe that they do. I'm good for 2. I'm good in the morning, and I'm good when I get home from work, before I go to bed, right?
Sure.
But that middle of the day kind of thing is a little difficult at times.
Yeah, I mean,
right? Even like, I sometimes do buy, though, the little tiny, like, portable brushes or whatever. And because I talk to people, I don't want to have bad breath.
Absolutely.
So I'll do like a squirt, I'll do like a dissolve, like a breath mint, things like that. But to actually brush them, right? Do you think it's still required 3 times a day, or
at least the twice a day? You know, morning and night. I'd say the flossing is more important because there's a lot of tooth surface that you're not getting with those toothbrush bristles. So that's, you know, more important. Obviously, I'm not telling you don't brush your teeth, but if I had to pick which one's more important, I'd say the flossing.
Gotcha. I also have like, I don't know if I can say the brand name, but I have one, I have an apparatus that squirts, like power washes your teeth with water. Okay. So how do you feel about those types of things?
It's a great supplement with floss.
Yes.
It's not a substitute for floss, meaning the ideal way to use that is you floss first and then use that, like you said, like a power wash. Exactly.
Okay. Now, what about flossing between the kind that is like waxing that you get out of the white box, or I've been using like the little free picks? Are those okay to use or not?
They're okay to use. You know, studies show it's more about effective technique as opposed to, you know, what you're using per se. The most important thing, here's one tooth, here's another tooth. They make a contact point. You use floss like a squeegee, so you get a nice tight C shape all the way to the point of resistance. Squeegee up at least 3 times on the one tooth and squeegee up 3 times on the other tooth in that contact.
Oh, you're supposed to go up?
You're supposed to go.
Are you talking about the bottom teeth?
Bottom teeth. Yeah,
okay, bottom teeth you're going up, and then top teeth you're going down.
Correct. Yeah, you go to the point of resistance at the gum, and then you squeegee up against the tooth in a tight C shape.
Interesting.
Yeah.
Not just between the teeth.
Exactly. People think it's just to get that little piece of meat out.
But they're not doing the lean in.
No, it's like think of it like a squeegee up against the actual tooth surface.
Excellent. Well, you have a beautiful smile.
Thank you.
Yeah,
Thank
you have a beautiful smile.
Thank you.
So when somebody comes to you for the first time, right, what is that onboarding process like? They're walking through the front door and they're like, I'm here, and they're probably like a little nervous.
Absolutely, yeah. I mean, you know, it's very common to be, you know, phobic and anxious when it comes to a dental visit. A lot of people either have had previous trauma or they've been avoiding going altogether and knowing, you know, and anticipating that they may need some work done. So we try to make things as comfortable as possible for our patients. So we do online forms before you even get here, so this way you don't have to worry about, you know, any paperwork type of stuff. When you come in, our staff greets you. We give you an office tour. You know, we show you, you know, the staff, the office, you know, all the technology that we have, you know, things that can make treatment and your appointment more comfortable. And then, you know, from there we start with, you know, a comprehensive set of records. So we take a scan of the mouth, no radiation. It's like almost like a 3D picture of the mouth to show patients on the screen exactly what everything looks like. I'm a visual learner myself. It helps me show people and, you know, hopefully understand, oh, okay, yeah, this is what's going on. From there, we take any x-rays that are needed, we chart the gums, and then we have, you know, an in-depth discussion about, you know, the patient's, you know, chief complaint, but also other findings that we find on these records.
Now, also growing up, people would say you'd eat carrots, so it would help your eyes, right? Is there anything somebody can do that actually does help your teeth?
Of course.
Okay, what are those things?
Yeah, so, I mean, obviously, like we talked about, oral hygiene is crucial. So flossing before we brushing, you know, twice a day ideally. Our diet is a huge aspect as well. So with our diet, you know, anything that is broken down into a carbohydrate, so simple sugar, any kind of sugar, the bacteria that causes cavities will eat, break down, and cause tooth destruction, basically. Avoiding acid exposure as much as we can, because that acid will also start to wear away the tooth structure. Doing things to keep the salivary flow. So what that means is like chewing sugar-free gum, staying well hydrated, so not just water, but electrolyte balance.
And those are helpful things.
Yes, yep.
Okay.
All these things will help, you know, prevent things that can cause issues, such as the bacteria that causes decay.
Wonderful. And I know that you said that you love art and you love science. We were talking about 3D modeling and things like that. And I noticed you have a 3D model Yoda.
I do.
Right? So,
I do, yep.
So Star Wars fan, right?
Yep.
So, okay. And he kind of looks like he's a little tooth. He's really cute.
Yeah, this was the first thing I 3D printed at a course. So
excellent.
Got to do that. Yep.
Excellent. Well, may the fourth be with you all the time. You know, it's so it's so joyous. Like I said, I feel like I got to know you a little bit by talking to you on the phone so often. But I also thank you, because had it not been our conversation, I would not have known that a dentist can help you with sleep apnea.
Yeah.
I would have not known that I actually have sleep apnea, which I do. And so you work with a company called sleeptest.com, and it was really easy, Dr. Andrew. I mean, you walked me through it. Your team was wonderful. I was able to I wore the ring at night, you know, and I put it on my thumb. I'm a big follow the directions kind of girl. Right?
That's all we can ask.
I read it. I watched the YouTube video. I watched it again, and I'm like, okay, I got to do it. I got to do it right. And then I sent it up. And they were able to get the results back within a few days, 3 to 5 days. So I will be talking to you. Let me just look at my audience for a second. And I will be walking you through this journey, because if I need to go through it, possibly you have to go through it. A lot of my high school friends are wearing CPAP machines. I'm going to try the dental apparatus first, and we'll see how it goes. But I'm Donna Drake. I've been visiting with the wonderful Dr. Andrew Adly. Be well.
Thank you.